Another one is the site of the murmur at aortic regurgitation area. It is right second intercostal space. So we will be looking at also other. Okay, so here in this image we can look at different areas to auscultate the murmur. Now aortic area is auscultated here in this region. This is right side of the sternum, and aortic stenosis is auscultated here. Next one is pulmonic area is auscultated here in the left side. Tricuspid area here in the holosystolic murmur and diastolic murmur is auscultated here, and mitral area is auscultated here. So in this way, there are different locations and positions for auscultation of the murmur, and then okay, so the auscultation is, as we heard, that aortic regurgitation is auscultated second intercostal space, right side of the chest. In tricuspid, there is fifth intercostal space. Pulmonic auscultation is at the second intercostal space, with mitral is the fifth intercostal. This is very important to memorize for examination point of view. Okay, so the next one on histology, flask shaped cells and multiple dendritic synapses are there in which structure? It is in cerebellar cortex. H2 receptor blocker is not the therapeutic value in which condition, which is Zollinger-Ellison syndrome. Zollinger-Ellison syndrome is the condition in which there excessive acid secretion. Okay, so in this condition, there is triad in Zollinger-Ellison syndrome, which is gastrinoma, excessive HCl secreting tumors. There is pancreatic or duodenal tumor that result into the excessive secretion of gastrin, which results into the hypersecretion, excessive parietal cell, enterochromaffin cell secretion of the HCl, and there is ulceration, peptic ulcers. Multiple treatments are there at ulcers are usually places like in Zollinger-Ellison syndrome. There is excessive secretion of the HCl results in the ulcers. So in this way, we can say that Zollinger-Ellison syndrome is a condition which must be managed, and it is associated with like uh, multiple endocrine neoplasia type 1, like in which pituitary, pancreatic, and parathyroid hormone related problems tumors can arise. Pancreatic tumor, islets tumor, gastrinoma secreting tumor, which results in ulcer. Treatment is PPI with surgical resection of the affected tumorous. Urinary problem is associated with answer is schistosoma, hematobium, glial fibrillary acid protein is positive in astrocytoma, tumor in astrocytes. And astrocytes are the waste mostly present in the brain. A patient having severe metabolic alkalosis means we can say increased sodium level. BP was 150 and 90, that is hypertensive condition. Serum sodium is 150 and potassium is 3. There is increased aldosterone level in the blood. What condition can this be? In Addison disease, it is not presentation. In primary hyperaldosteronism can be indicated because sodium is increased with aldosterone is also increased. Adrenal hyperplasia does not present with this condition. Secondly, hyperaldosteronism not present. There is primary hyperparathyroidism not also present. So the answer is primary hyperaldosteronism, in which excessive sodium with excessive aldosterone is there, and there is alkalosis means increased sodium level while there is no any change in the potassium. So this is the primary hyperaldosteronism. Next one is a patient present with pregnant woman visits her family in the remote area. Jaundice, which type of hepatitis can be there in the pregnancy and remote area? That is hepatitis E, occurs because of poor socioeconomic culture. Which of the following virus is most dangerous virus in pregnant ladies? It is hepatitis D. D is the most dangerous virus in the pregnant ladies. Okay, so here we can see all presentation related questions. Orophycal route is hepatitis A most commonly, and then hepatitis E. Most lethal is hepatitis D. Most common in pregnancy is hepatitis A. Most lethal in remote areas is hepatitis E, and transmitted from IV lines or any break, that is hepatitis B and C. Which of the following next question is a 45-year-old patient having dyspnea, difficulty in breathing, dry cough, fever for 3 months, recovered for 1 month. When she went into the vaccination again, developed symptoms. When she got back her canaries, X-ray shows multiple nodular lesions, means multiple nodules and lesions are there in the lung. Which mechanism is this? This is antigen antibody mediated reaction and hypersensitivity pneumonitis. This condition is hypersensitivity pneumonitis. In this image, we can see hypersensitivity pneumonitis. Hypersensitivity is allergic immune mediated. Pneumonitis is inflammation of the lung in which there is inflammation of alveoli, and there is shortness of the breath, fever, and certain inflammatory related signs and symptoms are there. Next question is, in crescentic glomerulonephritis, antibody complex deposited in GBM, which hypersensitivity it is? It is type 2 hypersensitivity. So we will be looking at the types of Okay, so here we can see all four types of hypersensitivity. Type 1 is if there is any degranulation process is there. Type 2 is when there is antigen antibody complex formed and complement activation is there, and free floating immunoglobulins when bind, then that is type 3 hypersensitivity. And type 4 is when there is antigen binds with the Th1 creates cytokine activates macrophage with the T cytotoxic T helper cells. That is type 4. And in depth we will be looking the difference.